Hi, everyone. Welcome again to the Data Fair. We're happy to have you join us today for this webinar titled NIH Data Sharing Guidelines, Charting the Course for Compliance. I want to give a warm welcome to our presenters, listed here in alphabetical order. Kathryn Lavender, Data Project Manager for the National Archive for Computerized Data on Aging, or the Aging Archive, NACDA. Sarah Rush, Data Project Manager for Data Sharing for Demographic Research, DSDR. And Chelsea Samples-Steele, Data Project Manager for the National Addiction and HIV Data Archive Program, or NADAP. I'm Kyrani Simon, and I'm the Data Project Manager for the Members Archive, and I'm going to get us started with a little overview. So first, we are going to talk about the policy, the NIH Data Management Sharing Policy. Then we're going to go through ICPSR services and support for this policy. Next, we're going to talk about elements of the DMS plan. Then we're going to give you some considerations for sharing data with ICPSR. And then we're going to open up the floor for Q&A. First, I'm going to give an overview of the policy. So effective January 25th of last year, NIH began requiring all investigators to submit a data management and sharing plan with their grant applications. The goal of this policy is to maximize data sharing by NIH investigators. Data sharing enables increased transparency around research findings, reuse of hard-to-collect data, and data set linkages or combinations that otherwise may not be possible. The expectation is that most NIH-funded data will be shared. Even when data cannot be shared, all of it will be managed, meaning all investigators who propose to collect data will be expected to follow a data management and sharing plan. On this slide, we have linked out to the policy and also pasted as a portion of that language here. This policy applies to all research funded in whole or in part by NIH, which generates scientific data. The policy lists certain activities that would not be considered scientific data, such as infrastructure, training, and other non-research activities. Under the new policy, you are able to include costs for data management, data curation, preservation in your budget proposals. This includes costs for managing data that you do locally, as well as costs to curate and archive data through a repository or multiple repositories. Here again, there's links out for you to find out more information about this. NIH has also identified costs that you should not include in your data management and sharing budget. This includes infrastructure costs, such as facilities and administrative costs, and routine research costs, such as data collection or data access fees. So now I'm going to pass it over to Sarah Rush to talk a bit more about our services and support for the policy.
Thanks, Kyrani. In this next portion of the presentation, I'm going to focus on ICPSR as a data repository option and also share information about how ICPSR can help you meet the requirements of the policy. First, I want to discuss the benefits of using ICPSR as a repository for your NIH data sharing needs. NIH has defined characteristics that are desirable in data repositories to help investigators select an appropriate repository for data sharing. Investigators are directed to use domain repositories over generalist repositories when possible. As a domain repository, ICPSR meets all of the desired characteristics described by NIH and has extensive domain experience managing and sharing human subjects data. I'm going to go quickly through each of the desirable characteristics you see listed here that have been identified by NIH and also share how ICPSR meets these requirements. So first, unique persistent identifiers. ICPSR assigns each study a digital object identifier, or DOI, which is part of the recommended data citation. The DOI resolves to a study homepage And the study web page, as well as an explanation, is maintained for any study that's deaccessioned. Long-term sustainability. ICPSR is over 60 years old. We've been around for a very long time. And we have a full set of data stewardship policies, including a plan to transfer data to a partner organization should the ICPSR organization close operations. Metadata. ICPSR ensures data are accompanied by metadata to enable discovery, reuse, and citation. ICPSR maintains study, file, and variable level metadata for data from NIH investigators. The study level metadata includes information used to build the data citation, study methodology, and other information about the study. ICPSR follows the Data Documentation Initiative, or DDI, metadata standard. ICPSR makes use of controlled vocabularies for consistency, and all metadata records are reviewed by ICPSR metadata staff before release. Curation and quality assurance. ICPSR provides tools and guidance to researchers depositing data. Our resident unit of expert curators review, organize, and document data using specific tools and processes, and also follow a robust quality assurance process. Free and easy access. ICPSR provides broad, equitable, and open access to the greatest degree possible for datasets and their metadata. NIH data are available to all researchers free of charge when NIH investigators deposit data into ICPSR through one of the NIH-funded repositories. For data that's deposited and curated by ICPSR, data are free to members. Now, members can pay a fee to access these data that have been provided through membership. ICPSR curation services may be directly budgeted into an NIH proposal so that data are available at no cost to both members and non-members. Broad and measured reuse. ICPSR makes datasets and their metadata available with the broadest possible terms of reuse. Redissemination of data is not allowed. However, ICPSR has a process to review requests for this. ICPSR also provides a bibliography of data-related literature and usage tracking to measure reuse of data. A recommended data citation is provided with each study to encourage proper reuse. Clear use guidance. All public ICPSR data have an associated terms of use documenting the appropriate uses of the data. Our restricted data available through ICPSR require an application and have a restricted data use agreement that researchers wishing to use those data must agree to. Security and integrity. ICPSR has a privacy and security team that monitors and regularly updates our security policies and practices and manages our incident response protocol. ICPSR supports access to FISMA and HIPAA-controlled data, and also offers tiered access to sensitive data based on the level of sensitivity, risk of re-identification, and/or the risk of harm associated with the data. Confidentiality. ICPSR has a data stewardship policy committee, a data privacy and security officer and team, as well as a disclosure review board that work in concert to set policies, practices, and keep data safe. All deposited data to ICPSR undergo a disclosure risk review. ICPSR staff undergo training on data confidentiality, and data curators follow ICPSR disclosure review guidelines to ensure data confidentiality is maintained. Common format. ICPSR primarily distributes data files in 8 data formats, which include 3 plain text formats, 2 SAS formats, 2 SPSS formats, 1 Stata format, and it's worth noting that virtually every data file is available in a plain text format. Provenance. ICPSR retains earlier released versions of a study and provides a versions tab on the study homepage. The version history section of the study homepage provides a text description of what's changed, as well as a timestamp. Previous versions of the data are available upon request. Finally, the retention policy. ICPSR permanently archives deposited files, and while deaccession data are no longer publicly accessible through ICPSR, they are still preserved. Because digital files are assigned a persistent DOI, the study description will still remain available for viewing. Next slide, please. ICPSR has multiple options for sharing data supported by a variety of sponsors and teams. First, there are the 3 NIH-sponsored topical archives that accept data on relevant topics. There's DSCR, or Data Sharing for Demographic Research, which is funded by NICHD, NACDA, or the National Archive of Computerized Data on Aging, which is funded by NIA, and NADAP, or the National Addiction and HIV Data Archive Program, funded by funded by NIDA. I'm going to put a link in the chat right now where you can get more information about all ICPSR funded archives. And next slide. ICPSR also has a membership archive, which is supported by membership funds. Within this archive, there's both a paid option and a free option for sharing data. And finally, ICPSR has a self-publishing archive called openICPSR. This option is best for replication data and is not recommended for sensitive data. It can be a good option if you need to make your data available very quickly. Next slide. On the ICPSR Share NIH data page, which you can access using the QR code we have displayed right on the right-hand side, you can find links to a number of helpful resources to help with the proposal phase and beyond, including a template NIH data management and sharing plan, which includes pre-filled information about ICPSR and its topical archives that you can modify as needed should you choose to share data with us. There's also information about how to budget for data archiving and a link to request an estimate. We have our contact information for questions or to request a letter of support. And finally, there's links to recent webinars that we've given on this topic. There are also NIH pages that provide additional guidance to help with preparing your data management and sharing plans, including the links shown here. And I'm now going to pass the presentation on to Chelsea, who will dive deeper into data management and sharing plan requirements.
Thank you, Sarah. Now that we've gone through those resources and the information about ICPSR and its archives, I want to focus on this major component of the new policy, which is the data management and sharing plan. We receive a lot of questions about preparing the plan here at ICPSR, and so we wanted to walk you through how to create this document. Next slide. NIH defines the data management and sharing plan as a plan describing the data management, preservation, and sharing of scientific data and accompanying metadata, and says that the plan should outline how scientific data and any accompanying metadata will be managed and shared, taking into account any potential restrictions or limitations. You can find a link to the final policy here again. Next slide, please. And more detailed information about what the plan should look like. It should be no longer than 2 pages long, and it should reflect the research team's plans around data management, sharing, transparency, and reuse for all scientific data produced, and should not include hyperlinks or URLs within the plan. It should include the 6 elements listed here under plan elements. Those are data type, related tools, software, and/or code, standards, data preservation, access and associated timelines, access, distribution, or reuse considerations, and oversight of data management and sharing. We'll go through each of these separately now, including how to respond to each one with information about ICPSR relevant to each item here that you can include if you are deciding to share data with ICPSR or one of our NIH-sponsored archives. So with this first element, data type, the information in the How to Respond column on this slide and on future slides in this section is drawn from the NIH data sharing website, and it reflects our understanding at ICPSR about what NIH is generally looking for in each element. Some of this information could vary depending on the particular institute or center that you will be working with. So please keep that in mind and always defer to your specific agency or center's instructions. But in general, the data type element should include the following types of information: the types and amounts of data that will be generated, what data will be shared or not shared, as well as any ethical, legal, or technical limitations for why those data will or will not be shared, and a list of metadata and documentation that will be produced, including codebooks, survey instruments, or other similar documentation. Given this, we provided some information about ICPSR that's relevant to this area that you may wish to reference or refer to in your data management plan. ICPSR accepts a wide range of data types, including quantitative, qualitative, geospatial, imaging, and video data. We refer you to our collection development policy if you'd like more information on the types of data that fall within scope at ICPSR. We manage access to confidential data through our restricted data dissemination practices. We have a lot of experience and expertise in handling sensitive data. And regarding metadata and documentation, ICPSR also produces codebooks, and the codebooks and study documentation that you provide, as well as metadata or additional information about your study, will all be made available on our website alongside the data that you've shared. Next slide. The next element is related tools, software, and/or code. In this section, you are asked to describe any tools or software that are required to access or manipulate the data. For the ICPSR information, regarding software types, ICPSR releases the data in many formats, which Sarah talked about earlier. We do this to allow for the greatest possible accessibility of the data. And our standard suite of data formats for quantitative data includes SPSS, SAS, Stata, R, ASCII, and delimited formats. ICPSR is also able to publish code or syntax for merging, linking, or other data manipulations alongside your data. So we encourage you to submit code to ICPSR when it would be helpful for secondary users. And we are also able to link your study to your code on another platform if that's where you choose to share your code. Next slide. Element 3 is standards, including describing any applicable standards for organizing and accessing the data and metadata, such as formats, metadata standards, and so on. ICPSR follows the Data Documentation Initiative metadata standards for studies that it accepts. We also use controlled vocabularies to ensure consistencies across studies that we produce and that we disseminate. And we've also included a link here to more information on the metadata standards in DDI that you may want to refer to when you're building out this portion of your data management plan. Next, thank you. The next element is data preservation, access, and associated timelines. And in this element, you will need to share details about the following: the name of the repository where the data will be archived, how the data will be findable and identifiable, when the data will be made available and for how long. And please note that NIH expects that the data are shared no later than the publication or the end of your award, whichever comes first. So the ICPSR information here regarding the repository, since this is permanent archiving, to pay for archiving at ICPSR, you would need to budget for upfront costs, and that is relevant to what you are writing when you are identifying the archive that you want to share your data with. That is important information to consider. So regarding the timeline, ICPSR will curate and release the data as quickly as able upon receipt of the files, with the understanding that time from receipt to release of the data can depend upon the size, quality, and condition of the data when we receive it, the number of curatorial actions that we need to take with the data, and the number of data collections that are currently in our queue for processing. And regarding how the data will be made findable and accessible, All data that we release are accessed on our ICPSR website, as well as the particular archive website if you are sharing data with one of our NIH-sponsored archives, for example. Researchers can use our robust website search tools to search for data and variables of interest, thanks to the metadata that we also create for each study. Next slide. Okay, a couple of additional points for this plan element. All data that are released by ICPSR receive a digital object identifier, or DOI, which is a unique persistent identifier that ensures that the data are permanently available and identifiable. And data released by ICPSR have metadata in DDI format, so this is another place where this becomes relevant, including both data and also variable level metadata, which further enhances the discoverability and findability of the data. Next slide. The fifth plan element is access, distribution, or reuse considerations. You will need to describe informed consent, privacy and confidentiality protections, laws or regulations, and any other considerations that may limit the extent of data sharing. You'll also need to state any plan to communicate this limitation to organizations that will preserve and share the scientific data. To address these issues, ICPSR's curation staff conduct a disclosure risk review of all data that we receive, the results of which will inform the appropriate restrictions to place upon access to the data. ICPSR provides data available via public use files, which still require registration with ICPSR and agreement to our terms of use. But we also make data available via restricted use files, which would require an application prior to use, also including a signed restricted data use agreement between the requester's institution and the University of Michigan. So we also offer tiered access to restricted data, where more sensitive data or data that have a higher risk of harm can have additional restrictions or protections placed upon them for people to access them. The plan element also includes additional considerations for addressing human subjects protections, which are listed here, but we also wanted to point you to ICPSR's guidance on informed consent language. You may find helpful information at this link on writing your informed consent language in a way that makes it transparent to study participants that the data will be shared and what that means for them and their information. Next slide. The final plan element is oversight of data management and sharing, and in this element, you will need to describe how compliance with the DMS plan will be monitored and managed, the frequency of oversight, and by whom at your institution, so the roles and titles of the people involved in monitoring the compliance with the plan. ICPSR's recommendation is to identify an individual or individuals on the research team who will be primarily responsible to ensure appropriate data management and sharing protocols and practices. And the research teams that we interact with at ICPSR about data management and sharing, the person that has this level of responsibility is generally the principal investigator of the project or their institution that enters into a deposit agreement. Some larger projects also have data managers who share that responsibility and role with the principal investigator. And some projects also have data coordinating centers, which may share in that responsibility. Okay, so next I will pass it over to Kathryn to talk about the next section of our presentation.
Thank you, Chelsea. Okay, so now that we've reviewed the data management and sharing plan components, we're going to walk you through some guidance for sharing your data. Next slide. So preparing to share or deposit with ICPSR, we use those terms interchangeably. It's kind of like a puzzle. And I say this because, you know, we're looking at pieces of a whole and basically taking everything you gave us and trying to, you know, make an image for the end researcher, the secondary researcher. So, and, you know, even a puzzle might not be completely a good analogy, because with a puzzle, you know, it forms a picture. You at least have the picture. even if you don't have all the pieces, you know what I mean? But with data, if we don't have the proper pieces, then it's not usable. And those pieces, I like to think of them as metadata. So data without metadata is just sharing it. It's just not going to be possible. It's just hoarding. So anyway, metadata are the key to solving our data puzzles here, and you provide those pieces. We think that every deposit is unique. And, you know, sometimes we get series, which are just maybe the same, you know, collection over and over again, but even those, you know, can have inconsistencies or pieces that make them unique. But what does an ideal deposit look like? Well, clear file names and connections between those files. And this applies to whether or not you would be giving us data to curate or data that you would self-publish. So clear file names, always a must. Uncorrupted, manageable data files. So you want to make sure they all open the way they should. Complete variable level details, so complete value labels and missing data information. Complete documentation and clear reuse terms and access intentions. Next slide, please. Okay, so as I noted, metadata is the key to these data puzzles, and so it's very important. And the fields that you complete in the deposit form, again, whether you're using the curated options or our self-publishing options, they directly relate to the study metadata fields that ultimately display on our website, on our study pages or project pages for self-publishing. And so that information becomes viewable and searchable to secondary researchers on all of our ICPSR sites. And so, you know, we can use these fields to convey a variety of important features. And so, like, say in your data management plan, you're going to be sharing some data with us, but you might be sharing other data with like a biobank or something like that. Include that as a note, and we can make sure that that appears on the study page so that the end researchers understand where to go to get everything they need. Next slide. Okay, so documentation is also very important. Stata codebooks or SPSS output is acceptable. This is a very common question we get about like what can constitute a codebook. Those things definitely help us, especially our curation team when comparing how the data are supposed to look versus maybe how it opens. And so, yes, we want whatever documentation you can give us, we want to paint the whole picture or complete that whole puzzle. And so consent forms, if you have them, great, we want to see them. Questionnaires, definitely. Code books with clear variable names. And basically we want to have, you know, we want to try to have sort of a one-to-one match between the variables that are in the data and where they originated, whether they're survey questions or whether they're derived variables. User guides are also helpful. Sometimes these are called readmes or user manuals, and this can include information on weighting the data and merging, and we want that information too. People love an easy button, so help us give them those easy buttons. And you know, you might think, oh, but I'm a Stata user. Why would you want my merging syntax just for Stata users? Well, it's a language, and that language is translatable to other packages. So speaking of other languages, say you did a survey in Spanish and in English. We want both surveys, but that English version is the must. We require that so that we can curate the data or so that it can be searchable because we are based in an English-speaking country mostly. So yeah, we want those. We want variable crosswalks, especially for longitudinal data. So if your team is keeping track of the variables that are included over time, give us that Excel file or whatever, however you format it. Question text. Question text is the description or the question that's associated with any variable. And if you have that somewhere, whether it's in the code book or a separate file, we want that. Okay, next slide. So here are some tips on preparing your data for sharing. And, as far as data management plans, these aren't things that the government is going to want to know, but these are things we want you to know prior to sharing the data with us. Don't use periods in variable names, please. This is not friendly variable naming across all stats packages. If you do this, then we have to rename them in order for them to be converted into multiple file formats. Of course, that's just for the curated option. But if you were to self-publish variable names that have periods in them, then that means that somebody who downloads your data has to then convert them to use them in whatever package they prefer. And, the more changes we have to make to data, the more room for errors there are. We do want you to use descriptive and unique variable labels. And I think that I probably have said a couple times already. If you're planning for public use data, you should consider limiting or avoiding open-ended response variables or string variables. And this is because they pose a higher risk to re-identification than numeric variables, because you never know. Say you even only have like 400 cases and you have this open-ended response. You have to review those to make sure that some respondent didn't write in that, they work for Ford in whatever city, and so does their brother or something like that. So you don't want to throw wildcards into the data. But yeah, remove direct identifiers, that's name and address, phone number, things like that. Label categorical values, avoid duplicate value labels. There's more here, but it just doesn't all fit in the slide. And I don't know, timing wise, if it makes sense for me to read through all of it, but essentially, just think about, I don't know, how someone else is going to be looking at the data. And if you have more questions about these tips, or if you're like, I'm not going to remember all of that, if you go to the ICPSR website, from any of the deposit pages, or at least most of like the ICPSR site or the funded archives, there are like tips, like checklists or other documents that are like, here's a guide to how to prepare your data for sharing. And those things, those resources would cover these tips as well. So yeah, one thing that's not in here is that if you're using Excel, just know that that's not ideal because they don't maintain variable formats. And as I've noted, the variable metadata, those are the puzzle pieces that we need. And so, yeah, you'll want to think about these kinds of things as you're, not only collecting your data, but organizing it later on. Okay, next slide. So when you're thinking about how to prepare your research projects, just consider the question, what would someone else need to know in order to use these materials without talking to me directly? That's what we need from you. And that's what the data community needs from you. So it's not what you think you need, or is it sufficient for you because you put together the project so you know it, by heart, but what anybody would need at any experience level. And so those are, defined variables, clear documentation, and, with restricted data, information about how it's supposed to be shared and who you said you would share it with. Okay, next slide. So if you're ready to share your data, we have some links here, some helpful resources. And, we're going to share all these slides with everybody who registered. And so you'll be able to access all of these resources. There's a couple videos that are embedded in the slide, and you might not be seeing them here now, but that's okay. Those resources will be there. And, if you ever have any questions, you can definitely email us. But yeah, review some of those depositor checklists and those guides that I mentioned. And I think now I'm going to hand it over to our next person for Q&A.
Thanks, Kathryn. As Kathryn said, I'm going to open up the floor for any questions that any of our participants have of the presenters today. please enter anything you have in the Q&A box, and we will get to your questions. The first one we have is, when asking for a cost estimate from ICPSR, should we include certain information such as branch of NIH or grant number if known? I can give a first take on this, and then somebody else may want to jump in. I say absolutely. It's always good to have as much information as you're able to provide. Knowing the branch of NIH that you're applying to, or even a grant number, if it's for previously collected data that your new proposal or project is related to, is useful, because what it allows us to do is put you in touch with the data project manager of the archive that is associated with the NIH branch. For example, NICHD, you would be referred to me at DSDR. So it doesn't change the estimate, but it's another piece of information that helps us work with you from the beginning. Kathryn, do you want to add to that, or? Oh, okay. Anyone else? Okay. Let's see. What is the timeline for sharing my NIH data? Does anyone want to take that, or get me to jump in?
I think that Chelsea had noted that it's by the end of the funding for the project that's required by NIH or by the first publication, right?
Yeah, that's exactly correct. So it's whichever comes first. If at the time you are publishing on your NIH data, you're expected to have archived though at least those components of your data that you've collected, the components that you've published on, and no later than the end of your award period, whichever comes first. As Sarah said, you are more than welcome and definitely encouraged to get in contact with us as early in the process as possible to let us know the data are coming. But that is the official timeline given by NIH.
Yeah, I would add to that. ICPSR recommends like at least two touch points early in your project. One's when you're writing the proposal. You may want to touch base to discuss costs like we've talked about, or even to talk through some questions you may have about your data management and sharing plan. Also, when you're awarded, it's good to let us know your estimated timeline for deposit, because otherwise we're not tracking your timeline. And we can then go through current expectations about how quickly the data may be released at that time. So it's definitely better to over-communicate, and you actually wouldn't be over-communicating because we would appreciate the context. All right, next question. How long does it typically take for a data set to be uploaded in the repository?
I can take this one.
Great.
Yeah. So if you are choosing to share data with one of our sponsored archives, I would be in touch with those project managers directly or that archive directly to learn about the timeline. So again, to what Sarah said, over communicating about any deadlines you have that you have to have the data available by. Us at ICPSR knowing that would be really helpful. Same goes for the member archive. If you have a deadline you need to have the data out by, let us know. Otherwise, things enter a queue unless you share a priority, your priority for getting the data out by a certain date with us. On the contrary, if you choose openICPSR, data are available immediately, published and available immediately along with the DOI. But if you choose to curate the data through a sponsored archive or our member archive, there could be varying timelines.
Okay, so a related question is, so do I need to know what topical archive I need to choose for my project in advance? Or how do I get connected with the appropriate archive?
Oh, Kathryn, you want? Okay. I see a couple people unmuting at the same time. Well,
Go for it if you want. Yeah.
okay, I'll just start and then others can share their thoughts as well. So no, you don't need to know in advance because we are all connected to each other within ICPSR and we share information with each other. If somebody has reached out to our general support line and said, I have for example, a NIDA funded project and I'm looking for a place to archive it and I think ICPSR is a good idea. Our team knows that when they see something is funded by NIDA, they can contact the NIDA funded, NIDA supported archive within ICPSR to determine if that's a fit for those data, or the same case with the other NIH funded archives within ICPSR. Also, from the NIH policy perspective, you are more than welcome to list an archive in your data management sharing plan that you think you're going to archive your data with, but that may change down the line and that is fine. It's okay to change your mind later of where you're going to share your data.
Thanks, Chelsea. Kathryn, do you have anything you want to add?
No, I think that covers it. I would say that, yeah, same thing. If you have questions, you can ask us. If you think that you can choose, you know, you can put that in your plan. We do appreciate the heads up. You know, if you write us into your plan and it's something that, well, let me give you an example. Somebody was planning to write NACDA into their plan and they had dynamic data and they also they were planning to use HRS and a bunch of other studies together. And they were like, oh, well, we're gonna share it using NACDA because HRS is already with NACDA. And this is a very common misconception. The Health and Retirement Study HRS is actually it's kind of such a, you know, rich resource that they have their own team and you know, they share and manage and preserve the data themselves. NACDA doesn't have HRS. And so the fact that they thought we had HRS already and that it was dynamic data, which meant it would be changing often, that's really not our strength. We are a more static system. And so, yeah, that's just an example of, do give us a heads up, but you don't have to know which one.
That's great. Thank you, Kathryn. I have another question that came in. What if I have multiple data types and I want to share them with different repositories? Kathryn, I feel like you might have touched on this a little in your section.
Yeah. So tell us, you know, we can include notes and references to where the different components are housed, and we're happy to do that. We want researchers to easily be able to locate whatever they need for reuse. And yeah, we'll help you in whatever way possible to make sure that that information is clear. I don't think that NIH will have an issue with that as long as you have a plan. And I've even seen times where like we get plans and maybe somebody's collecting the data through video, but they're actually planning to just transcribe everything and not share the actual videos, but they're going to share the qualitative data. And it is acceptable to note that to NIH that you know, some data won't be shared because of its extreme vulnerability or something like that. Like those are things you can include. But yeah, I think, you know, just be mindful that they do want like 2 pages and under for these plans. So don't get too lengthy in your wording. But yeah, we're happy to help and that's totally fine. I think it's more just about making sure you're sharing the data properly and doing the best you can with that.
Thanks, Kathryn. one more question that we had. How do I go about estimating data sharing costs in my budget?
I can take this one and others can chime in. In our presentation, we shared a link to get a cost estimate. So that is the place I'd start. We like to officially record any inquiries we have, and also this counts as a place to pre-register with ICPSR. And the cost estimate you fill out will ask you questions. I think this is one of the first questions, which agency are you planning to submit to, all about the data type, is it qualitative or quantitative data, all the information we need to collect to be able to estimate what the curation will be is what we'll be asking about. So I would start there, and you can just reach out to us we link the form here, but if you have additional questions, when submitting that form, you can contact us via our help desk.
Okay, I've had one more question that has come in. Let's see. Does depositing count as archiving, even if it is not released? That's an interesting question. I definitely want to hear from my co-panelist. One thing I would say is that the data management and sharing plan, sharing is in the name of that, and I think the sharing component is important. Yeah, I'll let Chelsea jump in. That's one I haven't been asked before.
Yeah, so I don't feel that I can answer that from the NIH policy perspective. I can say that the answer may differ depending on the particular agency or group that you're working with at NIH. So when you have your award and you have your grant manager or project officer contact information, that would be a great question to discuss with them. ICPSR doesn't have we don't have a preference on when the data are shared. It's more of the requirement through NIH. So I would check with your grant manager. And if you find that the answer is no, that you need the data released by a particular date, that's all the more reason to get in contact with us as soon as possible to let us know that those are forthcoming and have a hard deadline, and we can manage our queue and our resources appropriately to accommodate.
Great, thank you, Chelsea. All right, any final questions? Okay. It looks like we've reached the end of our time together, and I want to thank everyone for attending. The recording of today's webinar will be available in the Data Fair playlist in approximately 48 hours. We invite you to visit the 2024 ICPSR Data Fair page to find the link to the playlist and to register for any of the remaining webinars for Data Fair this year. And with that, I will say thank you for being here, and I hope you enjoy the rest of your day.